A very good evening to all of you. It is indeed a pleasure for me to have a very, very renowned psychologist and a psychotherapist on this platform. She is an authority in the field. And if you talk about the areas of her expertise, they are amazing. She's an expert parenting coach. She's an expert on the field of guiding you guys to be in the field of career profiling. How should you do it? She is an expert on transactional analysis. You name REBT, CBT, all is her cup of tea. She is internationally known. She's taken a number of trainings and a number of awards, and she is the most renowned psychologist of the Northern India for sure, and is the founder director of Feeling Minds. She has published various research papers in national and international journals. We are extremely delighted to have with us on this platform a known psychologist, Dr. Cheenu Agrawal. Dr. Cheenu, it is indeed my pleasure to have you on this platform. And above all this, she's my teacher. So I'm extremely delighted to be interacting with her on this platform today. Well, when we were talking about subjects, there are so many subjects on which she can do a lot of justice. But keeping pandemic and the COVID-19 around, we thought the significance of positive psychology is a lot. Dr. Cheenu, I would like to ask you, what is the role of psychology in well-being?
Thank you so much, Dr. Alka. It's indeed a pleasure and a privilege to be talking to you today. And a very pertinent question indeed. What is the role of psychology in well-being? For decades, psychology has always been thought of as a subject which comes in only when there is something wrong. So it is thought of as a therapy. If something is wrong, then we need a psychologist or a therapist to set things right. Positive psychology is a thought. Positive psychology is an ideology. Positive psychology is a stream of thinking which says that psychology need not become, a panacea for what is wrong. Psychology can come in much before that. And Martin Seligman was the person who gave this term positive psychology, and he said that why not start strengthening what is right with us rather than thinking about what is wrong with us. And so he said, why do we wait for someone to get into depression? Why do we wait for someone to start having anxiety? Why don't we start, equipping people with coping strategies in advance? Why don't we help them to have a fulfilling and happy life before anything goes wrong? And that is a humongous role of psychology in well-being, to maintain it, to strengthen it, to prevent things going wrong.
Very, very rightly said by you, Dr. Cheenu, that always prevention is better than cure. And psychology plays a very, very big role. And rightly stressed by Dr. Cheenu, the significance of a thought process. Everything is right up here. It's nothing but right within us. So let's understand from Dr. Cheenu that what exactly positive psychology means, what it is.
Okay, so to be able to understand what exactly positive psychology means, I'll right away take you to the model of positive psychology that is famously called as the PERMA model. So where we have 5 letters, and now a 6th one, H, has also been added to it. So it concerns itself first with positive emotions. Interestingly, we human beings are born with negative emotions where, we are born with hunger, and that's why as soon as we are born, we start crying for food. And we realize very soon that unless you cry, nobody is going to give you anything. And so we learn the first behavior that you have to cry. The second thing that we come into this world is with fear. And because we are very small, because we feel very vulnerable in this world, we start feeling, who is going to take care of me? And we are threatened by everything. Even a movement of a curtain can, be very threatening, monster-like to a little child. And so hunger, fear, and then disgust, and then anger, and then sadness. Out of all these basic universal emotions that we are born with, we lose track of positive emotions. And positive emotions then remain to be learned, remain to be reinforced. And so the first, like you have got factors to understand how economically healthy a nation is, or a state is, or an area is. Similarly, there can be factors for well-being. And how often do you experience positive emotions? How often are you able to, express them? How often are you able to share them with others? Can be one of the most important factors of well-being. And if I dwell a bit more on positive emotions, you can again divide it into three parts. Positive emotions for whatever has happened in the past. Sometimes you'll meet people who say that, our past has been troubling us. And so we are not happy in the moment. And so what is it that you can do about the past? You can have two emotions. You can train them in two emotions. One is gratitude and second is forgiveness. Whatever good has happened, learning to be grateful about it, and whatever bad has happened, learning to let go and forgive it. Then positive emotion in the present, savoring the present moment. We forget to live it. So what is it that we can do? Be mindful of what is happening right now. What is it that, the part of the journey that I'm living right now, that actually becomes the positive emotion for the present. And what about the future? You'll meet so many people who say they're anxious about the future. They don't know what the future holds for them. They have nightmares about the future. And so inculcating hope, optimism, these can be positive emotions for the future. This is what is positive psychology about positive emotions, about identifying them, about taking time to experience them, express them, and share them with others. So this is the first part of the model.
Beautiful. Thank you so much, Dr. Cheenu. Certainly, I agree with you on that. Most of the time, our mind is either worried about what happened in the past or anxious about what's coming in future. So it is so very significant for all of us to understand, to be in present, and mindfulness is the key. How beautifully you guided. Just let go, forgive. Forgiveness is divine, because when you cling on to things, actually you're harming your own self. So you're forgiving people not for others, but for your goodness. And also a wonderful concept of gratitude. That is lovely. And I think all these are the components which really keep you healthy emotionally. Dr. Cheenu, you mentioned about the PERMA model. I would want you to share with our audience a bit more about that, please.
Yes. And so the first P I have explained, that is the positive emotion. The second is E, that is engagement. Having an engaging life, having a flow in your life. So there are things sometimes when you do them, you feel so involved in those things that you just forget about everything else in the world, you know, whether it is a person you are engaging with, whether it is a piece of work you are engaging with, whether it is, something that you love that you are engaging with. So once you find things to engage with in life, that in itself generates positive emotions. So engagement, or it is also called as flow in the technical terms of positive psychology. When you find your flow, and sometimes you remember that, when you were reading a Milton Boone novel, or when you were watching a particular movie, or when you were cooking a particular thing in your kitchen, or when you were, taking your lecture on stage, you just forgot about everything else in the world. That is when you were engaged, fully involved in that moment. So that engagement is one of the components of the Parma model. And the third one is relationships. So social relationships are one of the major factors for well-being, for measuring well-being. How many friends do you have? Are you able to spend quality time with people? Because, by default, we are social in nature. We cannot do anything about it. We want others to acknowledge our presence in this world. You want to tell people, I exist. Please acknowledge my existence. We all want praise. We all want appreciation. We all want approval. And unless there are people to share with your joys and sorrows, you feel lonely, you feel sad. And so cultivating social relationships is the third factor, which is very, very important and advocated in positive psychology. So that gives us the per, and the M is the meaning. Why are you there in this life? So I remember in my childhood, there used to be lots of saints coming into our house, and they used to ask us questions like, we were very little, and we used to go and sit near them, and they used to ask us, why are you there in this life? And we used to look at each other. So they used to answer, to eat good food? Yes, we are here to eat good food. Okay. And to dance? Yes. And to play? Yes. And to go to school? Yes. And what beyond that? So what is the higher purpose of your life? Why is it that you are here, And Dr. Alka, it is so surprising to see that, so many people have not even thought about it.
Very true.
What is the meaning? What is the purpose of my life? And those who have thought about it, those who have found their purpose, they are a league different, They have already started on their journey, and they really don't care about petty things which disturb, upset other people.
Certainly. Yes.
The last one is A, or achievement. Acknowledging your successes. By nature, we are people who acknowledge our failures more. We do not want to say, that I got this, or, appreciate ourselves. We want to say, Ari, this is something which I wanted to have, but I didn't get in life. And so, achievement, accomplishment, and acknowledging your own successes. And now one more has been added, that is H. So it now becomes a Parmaha model. And so H stands for health. Unless there is health, nothing else can be achieved.
Very, very rightly said. Thank you so much, Cheenu ma'am. Now, is it that we were talking about positive psychology and being positive and the purpose in life? So anyone can use it? Is it for everyone? How does it really help human beings?
This is the beauty of positive psychology, that it can be used for everyone. Each and every one of us. We don't have to wait for feeling sad or upset or disturbed about anything to go to psychology. We can, each one of us can use it. And that is what we advocate, propagate, promote in Feeling Mind. Psychology is for everyone. Even for a small child, you know, I don't know about Dubai, but there are so many children in India at the age of 5, they are using the word depression. They're using the word stress. They're using the word tension.
Very rightly said, ma'am. Yes.
So we can use it even for a 3-year-old child.
Very right. A lot of teenagers nowadays very commonly use this term of depression and anxiety and stress. I mean, that's like a lingo they use. It's very, very common in that. Yes.
If there is any pandemic, Dr. Alka, this is the pandemic.
It is. I totally endorse it. Now, I really want to know that how does this kind of thought will help any individual? As you rightly said that, you know, it's been used by them, the negative terms are used by them and they're all under stress. How does it help them? And how do we take it to a layman who has no concept of psychology?
So we don't have to go into the technical jargons at all. It is their own world. It is their own life. It is their own journey. And when we help them, so like I said, if we talk about positive emotions and we help them talk about it, how many times during a day did you experience a positive emotion today? How many times during a day did you feel happy? If you chart it out, you'll find out there are so many times you felt anxious, there are so many times you felt angry, but you have forgotten the times when you felt relaxed or calm or happy or, you know, good about anything. And so just helping them to chart out their own day and then helping them to design a day where positive emotion, the experience and expression of positive emotions is more than that of negative emotions. So the beauty of psychology is it can be learned, it can be taught. We can train ourselves. We can train to become happier. Otherwise, there was no use of doing so many researches. There was no use of writing all these books. There was no use of, you know, creating so much of content around it if we could not have applied it. And so it is application of what you are trying to say is more important than, you know, writing or doing dissertations on it.
Very rightly said, Cheenu ma'am. It is very, very important to grow out of the theoretical word and see it in the practical applications. How does it happen? I would want you to share with our viewers today some of the wonderful techniques that how can they really use it and bring it to the applied aspect which you're talking about.
Yeah. So one of the techniques you can use is savoring the strawberry, where I told you, you know, about the present moment. So let us say you are eating this chocolate. You know, this is one of my favorites. I can't eat it now because I'm a diabetic, but I can keep it on my table at least, and I can see it. So engaging your 5 senses into this. So looking at it and having the pleasure of having your own favorite Cadbury in your hand, savoring it, savoring the moment of looking at it. Then unwrapping it. And then smelling it. Smell se to meri sugar nahi badi na. You can smell it. And I can savor it. I can savor the smell of this sweet Cadbury in this moment, you know. and I can bring it near my tongue. And maybe I can just touch it with my lips. And then...
अरे गुड्डी मच्छर आ जाएंगे और गुड्डी एक पोछा उठा लाइए बेटा यहाँ.
May I request you all to kindly keep yourself muted? Sorry for this, ma'am.
And then, if you want, you can take a little bite. Just with your teeth, not even taking it to your mouth. This is savoring the strawberry. Taking it in such a way, the moment that you have with you, engaging all your five senses in that moment. But what happens is, we take a bowl of dessert and we just eat it without even tasting it properly. So you have just added to your calories without feeling happy about it, without being mindful about that moment where you could have enjoyed that bowl of dessert with all the mindfulness. And so your audience can try this, savoring the strawberry.
This is lovely technique. And I'm sure that everybody would love. You know what happens, Dr. Cheenu, is that when you involve all your five senses, actually the experience itself becomes so enriching that the ultimate, the final goal, even if it isn't there, you don't miss it. So you're rightly saying that enriching every moment of it by using all your five sensory organs is an amazing technique. Would you like to share with them some more?
The sentence that you have used is exactly what is written in the positive psychology books. It is not the destination, but the journey that we enjoy.
Lovely, beautiful. And this makes it look and sound so easy that you don't need to be a psychologist for that. Anyone and everyone can do it.
Yeah, you can ask your audiences just to be mindful when they're having their breakfast, their lunch, and their dinner, and keep their gadgets aside. And first, just look at their plate. What is it in my plate today? Sometimes you have already eaten and you don't even remember the sabji or the vegetable that you have just had. You know,
Right.
At least give your, just look at it. What is it? What colorful things do I have? And I remember one of my dietitians once told me, which color is missing in your food? So are you having green, white, yellow, red, everything in your platter or not? So white stands for calcium, yellow stands for vitamin A, green stands for your iron-rich food. Or are all the colors there or not there in your food? And that was so insightful for me, just looking at your plate makes so much of sense. And then before you put the morsel in the mouth, savoring the, the smell, the aroma of the food. You have eaten a whole plate of biryani without even having enjoyed the aroma. You have missed so much.
Very right. Rightly said. And it is very, very important for being mindful, because even I think the quantity gets limited once you start to be more focused about every single bit or in every single bite. So then it becomes very, very significant. Thank you so much for bringing all this fine tuning to our viewers' mind and point of view. And I'm sure that each one is going to enjoy the meals for sure from today. Now, talking about positive psychology, Dr. Cheenu, somebody who's going through depression and anxiety and worries, and when you talk to them and suggest them, they say, my cup is already full, doctor. It's so challenging to bring that positivity up there. What would you suggest to them?
Yeah, this is a very pertinent question. Positive psychology is not about, just speaking about empty positivity. No, it is not. Positive psychology accepts that life is full of adversities, that life is difficult, that it is full of pain. But then how do you deal with it? What is your approach to it? we can teach our clients that.
Well, wonderful, wonderful. Thank you so much, Cheenu ma'am, for being with us today. And I think we enjoyed every minute of knowledge, wisdom, everything you shared with us. Thank you so much. And especially in this pandemic, you know, when the era started, everybody thought it is for few days became few weeks, and then few months. And now more than a year has gone by, and vaccine has come, but still the numbers are going high. So I think the lifestyle has totally changed, and every human being must include these factors to keep emotionally and mentally very, very healthy. So if you want, please follow the advices given by Dr. Cheenu today. Thank you so much for your time today, and we enjoyed every minute of it. Thank you very much, Dr. Cheenu. Thank you so much.